Today I'm going to talk to you a little bit about tips for managing tailbone pain. Tailbone pain is a rather common complaint, especially that we see here in the clinic. And sometimes it's kind of poorly understood. So a lot of times patients often see multiple providers before understanding what's causing the problem. They may have some imaging done. Imaging may not show that there is a problem. A lot of doctors will say everything looks great, but the patient is not able to tolerate sitting or other activities as well. Symptoms of tailbone pain includes, of course, pain with sitting, during or even after sitting, especially if you're sitting for long periods of time or sitting on a surface that's really hard. Sometimes it's pain with the transition from sit to stand. That can cause someone some tailbone pain as well. If the surface is really unstable or really soft, like sitting on a really comfy couch, sometimes that can be really aggravating. A deep ache around the tailbone is also a common finding that patients will complain of. Sensitivity to touch, so even just putting any little bit of pressure on that area. I've had some patients even talk about not even being able to lay down just because that pressure there is just too intense for them. Shooting pains down the leg. Sometimes we can see this. There's a lot of nerve endings in that area, even coming from the sacrum, but we also want to make sure that there's nothing going on with the low back if that is the complaint. Feeling like you're sitting on a marble or a knife or a rod, something that's just really uncomfortable. And then, of course, pain with intercourse, pain with having a bowel movement, or even while on your periods. These are common symptoms that we find of tailbone pain. Some causes can include if you fell on the tailbone or a direct injury to the tailbone, fallen on the butt, that can definitely cause that problem. Breaking a tailbone from, again, a fall or even a delivery. So during childbirth, a vaginal delivery, when baby's coming out, it can create a fracture there. There can be some alignment issues in the spine or the pelvis, and sometimes that can be a cause of why there's discomfort at the tailbone. Overactivity of the pelvic floor muscles, of course, that's a big one. And actually, that's typically what we see in the clinic. Our patients have gone and received treatment elsewhere, or they've tried orthopedic physical therapy, and it's helped to some degree, but it hasn't quite gotten to the main issue. And so there'll be some overactivity of the pelvic floor that we'll address. And then, of course, if there's some instability of the core. So tip number one for managing tailbone pain, take 2 towel rolls and you place them just where you're going to sit on the 2 butt bones. Okay, so you're going to sit them under your 2 butt bones to offload the center or the tailbone and sit all the way back in the chair. So again, I'm offloaded on the tailbone area, but the 2 hand towels are allowing me to kind of sit a little bit elevated. And then also putting this behind your low back, or another roll behind your low back, to also support you there. That's one tip, and that's especially if you have to sit for long periods of time. So say you have a job that you have to sit, you have to do computer work or desk work. That's an alternative that you can try to kind of decrease the tension on the tailbone. Tip number 2 is make sure you get up and move around often. Avoid sitting for long periods of time. So take stand-up breaks, walk often, avoid excessive pressure on the area. So try to get up and move. Sitting is not healthy for us anyway. So we want to make sure we're moving and getting up off of and taking pressure off the tailbone. Tip number 3, avoid butt clenching. It's common for a lot of people with tailbone pain to constantly be clenching or tightening their glute muscles together. And you may not even notice you're doing it until you're standing around and all of a sudden you're like, why am I holding tension in my butt? It's kind of like the people that clench their jaw or they hold their shoulders up to their ears while they're stuck in traffic. Kind of paying attention to your holding patterns as well. Tip number 4, try to stretch, try to move. So some common stretches you can try, or lying on your back, getting both knees up towards your chest, kind of opening up the pelvis, even stretching, like even if you're sitting, kind of propping one ankle on your knee. I don't know if you can see this or not, and then bringing your knee across your chest can help stretch out the buttock muscles as well. And a lot of those insert around the sacrum and the tailbone. So making sure that you're stretching and you're getting more mobility around that tailbone and around those muscles. Tip number 1, Offload while you're sitting using these towel rolls. Tip number 2, make sure you're up and moving around often so you're not always just putting pressure on the tailbone. Tip number 3, avoid butt clenching. And tip number 4, stretch it out.